So I'm going to talk to you about short-term complications of type 2 diabetes. So these are things you can see in the short term, and one of them is something called a hypo or a hypoglycemia. Not all people with type 2 will have hypos, but they are a little bit more likely if you take a class of drugs called a sulfonylurea, like glycoside, or if you're on insulin. Early signs of a hypo will be trembling or shakiness, sweating, feeling anxious, looking a bit pale, heart palpitations, things like tingling lips, hunger, irritability. Some people feel tired and they get a headache. More advanced hypo signs are things like a lack of concentration, confusion, slurred speech, and disorderly or irrational behaviour. And sometimes it can look to others like you're actually drunk. So the thing to do if you do regularly check your blood sugar level with a finger prick test is to test, and if it's 4 or below, that is technically a hypo. So another short-term complication of type 2 diabetes is something called a hyper or hyperglycaemia, and this is very high blood sugar level. So the signs that you might be experiencing a hyper are things like needing to go to the toilet more, weeing more, being thirsty, having a headache, and feeling very tired. So if you're getting these kind of symptoms, the thing to do is to drink lots of water or sugar-free fluid. If you are on insulin, you can at this point perhaps take a little extra insulin to help bring your blood sugar levels down. If you are having those symptoms and you're feeling sick, being sick, or generally feeling very ill indeed, you may be entering a state called a hyperosmolar hyperglycemic state, or HHS. And that is a sign that you have a very high blood sugar level indeed. So if you were to do a finger prick test, it would come out at around 30 or perhaps even higher than that. So HHS is usually slow onset. It occurs over days to weeks. And the things to look out for are frequent urination, great thirst, feeling nauseous, dry skin, disorientation, drowsiness, and gradual loss of consciousness if it's left. So this causes severe dehydration and it does need hospital treatment. So if you're feeling these symptoms, do get in touch with a healthcare professional straight away, whether that be your GP on the day or even NHS 111.